Hi, I'm Dante Veal. I'm a registered nurse, and I am presenting red yeast rice and its cholesterol-lowering benefits. Cholesterol lowering is important in the prevention of coronary artery disease and in also reducing morbidity and mortality associated with coronary heart disease. Statins are medications that are commonly used to prevent or slow the progression of coronary artery disease. Examples would be atorvastatin, fluvastatin, lovastatin, pravastatin, rosuvastatin, and simvastatin. Unfortunately, many patients are not able to tolerate statin medications because of something called myalgia. Myalgia is a muscle weakness or pain that is not associated with elevated creatinine kinase. Statin therapy is discontinued in about 10% of patients after 1 year of treatment and about 28% of patients after 4 years. Red yeast rice is a supplement from China that is made from yeast that is grown on rice and contains monocolin K, also known as lovastatin, and thus its cholesterol-lowering ability. Red yeast rice studies have been done that show that it has definitely a cholesterol-lowering benefit. One study consisted of patients who had previously discontinued statin use due to the myalgia. Patients were placed on red yeast rice 1,200 milligrams by mouth at bedtime for 40 or more weeks and had a reduction of 37 milligrams per deciliter of total cholesterol and 35 milligrams per deciliter reduction of LDL, and 89% of them were able to tolerate the red yeast rice. The study concluded that the tolerance may be due to the lower levels of the statin contained in the product or the patient's desire for natural supplement versus prescription drug. Another study compared red yeast rice and pravastatin and found no difference in the ability to decrease total cholesterol and LDL. The study done by Becker compared red yeast rice and fish oil with simvastatin and found similar reduction for both in regards to LDL levels. One of the bigger studies was done in China. It was the China Coronary Secondary Prevention Study. It was a double-blinded, multi-centered study that consisted of 4,870 Chinese. It compared red yeast rice and placebo and found that red yeast rice decreased total cholesterol and LDL by 13.2 and 20.2 respectively. The conclusion is that these studies have found red yeast rice may be an alternative to statin medication in regards to patients' tolerance. This may be related to possible lower levels of the monocolin K, lovastatin, as I previously stated, or the patient's preference to natural supplements versus prescription drugs. Thank you.